Disclaimer: I do not own the rights to the material or images. This was purely made for the purpose of studying for boards. General visceral afferent system. The visceral afferent systems consist of neurons whose dendritic zones are located primarily in the viscera of the body as opposed to the somatic afferent system, which innervates primarily the surface of the body. The general visceral afferent (GVA) system consists of neurons whose cell bodies are located in all of the spinal ganglia and in many of the cranial ganglia. Many of the tissues that are innervated by GVA neurons are derived from embryonic splanchnoplora. These GVA neurons are concerned with body temperature, blood pressure, gas concentration and pressure, and movement of viscera. The special visceral afferent (SVA) system consists of neurons restricted in their location to the specific cranial nerves that function in taste and smell. Anatomy receptor. Nerve. The receptors of the GVA system are located throughout the viscera of the body, where they are stimulated by a number of different modalities. Stretch, distension, and pressure on or in a viscous are the most common modalities. Some receptors are sensitive to chemical changes in the environment. Free endings and a variety of encapsulated endings are found at the dendritic zones of the neurons in the system. The axons course in the nerves that are most readily available to the viscous. In the head, they are the facial nerve to the middle ear and blood vessels of the head, the glossopharyngeal nerve to the caudal tongue, pharynx, carotid body, and carotid sinus, and the vagus nerve to the pharynx and larynx. In the thoracic and abdominal cavities, they are the vagus nerve and the branches of the sympathetic trunk that include the splanchnic nerves in the abdominal cavity. Here, in the body cavities, the GVA axons course toward the central nervous system, CNS, in nerves that contain neurons of the parasympathetic and sympathetic portions of the general visceral efferent, GVE, system. Figure 16-1. GVA axons from peripheral blood vessels course through the nerves to the segmental spinal nerves. The cell bodies of these GVA neurons are located in the geniculate ganglion of the facial nerve, the distal ganglia of the glossopharyngeal and vagus nerves, and the spinal ganglia of the involved spinal nerves. Horseradish peropsidase studies of the esophageal innervation of the dog have shown GVA neuronal cell bodies diffusely distributed in the distal ganglia of the glossopharyngeal and vagal nerves and the cervical and thoracic spinal ganglia. Brainstem and tracts. The axons continue from the various ganglia into the CNS. Those axons in the facial, glossopharyngeal, and vagal nerves enter the ventrolateral aspect of the medulla and course to a position near the lateral aspect of the fourth ventricle adjacent to the sulcus limitans. There, the axons course rostrally in a column called the solitary tract. See figure 16-1 and plates 13-15 in chapter 2. This tract is surrounded by neurons that form the nucleus of the solitary tract in which the axons in the tract terminate. This solitary tract and its nucleus develop in the alar plate adjacent to the motor column of the GVE system. Therefore, it is found dorsolateral to the parasympathetic nuclei of the facial, glossopharyngeal, and vagal nerves. The solitary tract stands out in myelin-stained sections as a dense cylindric structure surrounded by the unstained cell bodies of the nucleus. It extends from the level of the facial nucleus, GSE, rostrally to caudal to the orbix caudally. Caudally, the nucleus gracilis and medial cuneate nucleus are dorsal to the solitary tract and rostrally, the medial vestibular nucleus is dorsal to it. The nucleus of the solitary tract participates mostly in reflex activity and projects to neuronal cell bodies in the GVE system directly or indirectly by way of interneurons in the reticular formation that participate in the various metabolic centers that regulate visceral functions. These include respiratory and cardiovascular activity, swallowing, and micturition. The area postrema receives afferents from the solitary nucleus and participates with the medullary vomiting center. The area postrema is located on both sides of the caudal middle at the level of the orbix. It is adjacent to the floor of the fourth ventricle, dorsal and slightly lateral to the parasympathetic nucleus of the vagus. It is a unique parenchymal structure that is readily recognized microscopically by its abundance of small capillaries and glial cells adjacent to a flat layer of ependymal cells that line the fourth ventricle. It is easily mistaken for a neuropathologic lesion. The area postrema is one of the circumventricular organs that have in common the absence of a blood-brain barrier and an anatomic position adjacent to the ventricular system. Other circumventricular organs include 1. The subfornical organ on the caudal surface of the columns of the fornix, where they form the rostral border of the third ventricle. 2. The subcommissural organ that projects ventrally into the rostral mesencephalic aqueduct ventral to the caudal commissure. 3. The pineal gland that projects quadrantally from the dorsal portion of the third ventricle. And 4. The hypothalamic vascular organ adjacent to the ventral portion of the third ventricle. These sites are thought to be involved in such functions as chemoreception, neurosecretion, and the control of various visceral activities. They play important roles in the communication between the parenchyma and cerebrospinal fluid, CSF, and in communication with other organs via blood-borne products. Some neuronal cell bodies in the nucleus of the solitary tract project axons rostrally in a pathway of conscious perception. These course mostly on the contralateral side of the brainstem in an ill-defined solitary thalamic pathway that closely parallels the medial lemniscus and spinothalamic pathway. These axons terminate at a synapse in the ventral caudal medial nucleus of the thalamus, which, in turn, projects axons via the internal capsule to the sensory neocortex. Some of the axons of the GVA system receptors in the thoracic and abdominal organs also course centrally over the branches of the thoracic sympathetic trunk and the abdominal splanchnic nerves. Here, they are accompanied by the GVE neurons, which are coursing toward the organ innervated. See figure 16-1. From the sympathetic trunk, each of these GVA axons courses through a ramus communicans to the segmental spinal nerve, where it enters the dorsal root. The neuronal cell body of the GVA neuron is located in the segmental spinal ganglion. The axon continues over the dorsal root, enters the spinal cord at the dorsolateral sulcus, and continues into the dorsal gray horn, where it terminates on a neuronal cell body located there. For a reflex pathway, a dorsal gray column interneuron passes into the adjacent intermediate gray horn and segments T1, L4 to synapse on a preganglionic sympathetic GVE neuron located there. The pathway for conscious perception involves the synapse of a GVA telodendron on a neuronal cell body in the dorsal gray horn that projects its axon into the same side or opposite side lateral funiculus and courses cranially along with the axons of the spinothalamic pathway. This is probably a multisynaptic system that follows the same course as that of the spinothalamic system. General somatic afferent, GSA, including the synapse in the ventral caudal lateral thalamic nucleus for projection to the sensory neocortex. Some evidence suggests that for the organs of the body cavities, the GVA neurons in the vagus nerve are concerned with reflex activity, and those entering the spinal cord by way of the sympathetic trunk are concerned primarily with the conscious projection of visceral afferent stimuli, the source of visceral pain. In addition to these pathways from the dendritic zones in the gastrointestinal organs to the CNS, some possibly many. GVA neurons reside entirely within the wall of the viscus and an enteric plexus in which intrinsic reflex activity may occur. They are components of what is referred to as the enteric nervous system, which can function autonomously. Functional concepts must smooth muscle regulation is involuntary and occurs at a reflex level not reaching the level of conscious perception. The enteric plexus and ganglia, enteric nervous system, within the wall of the bowel can function autonomously, independent of their extrinsic innervation and the CNS. Autonomous pacemaker activity has been recognized in selected areas of the bowel. Visceral surfaces are, for the most part, insensitive to many of the stimuli to which the surface of the body is sensitive. No conscious perception of touching, pinching, or cutting of normal viscera exists. This is exemplified by the surgical rumenotomy or cesarean sections performed in cattle, in which only the body wall and the parietal peritoneum have to be desensitized by local anesthesia. The wall of the rumen or the uterus is incised without anesthesia and without causing any discomfort to the patient. Conscious perception, nociception, of visceral sensation is usually referred to as visceral pain. It occurs following tension or distension of the wall of the viscus or traction on their mesenteries. Diseased, inflamed visceral surfaces are sensitive to touching and cutting. Loss of blood supply, ischemia, to the wall of a viscus is a cause of visceral nociception. Visceral nociception is poorly localized to its specific source. It is reflected as a dull, deep, painful sensation in the body cavity. This may reflect the fact that compared with the GSA system, fewer GVA neurons are present, and they are stimulated only occasionally by modalities that are projected to the level of conscious perception. Thus, the cerebrum has little experience in localizing the source of these visceral modalities that come from structures that cannot be visualized. This provides part of the basis for the phenomenon of referred pain, in which a specific area of the body surface is hypersensitive and is considered to be where the visceral afferent stimulus is located that is perceived as pain. Referred pain and referred pain. The visceral nociception is referred to the surface of the body innervated by GSA neurons whose axons terminate in the same spinal cord segment and on the same neuronal cell bodies as the GVA neurons from a viscus. Figure 16-2. Thus, a dermatomal distribution of referred visceral nociception exists, and the surface of the body can be mapped to represent the areas of pain referral of the various visceral organs. For example, the diaphragm is referred to the shoulder and neck region innervated by GSA neurons and cervical spinal nerves 5, 6, and 7. The stomach is referred to the mid-thoracic region, T6, T9. The ureter is referred to the area of the scrotum, L3 and L4. Many theories have been proposed to explain this mechanism. The common pool theory proposes that both the GSA and GVA neurons synapse in the dorsal gray horn on the same neuronal cell bodies that serve as the conscious projection pathway by way of the spinothalamic system. The GSA system is stimulated frequently, whereas the GVA system is stimulated only occasionally. The site of stimulus by the GSA neurons is readily recognized on the surface of the body, and the brain has learned the source of the stimulus. When the same dorsal gray horn neurons are stimulated by excessive activity in the GVA neurons, the brain misinterprets the source and refers it to the origin of the GSA neurons on the body surface. The visceral reflex arc theory proposes that excessive GVA neuronal stimulation causes a reflex spasm in blood vessels of the peripheral body wall by way of sympathetic GVE neurons located in the same spinal cord segments. Release or accumulation of abnormal substances at the site of the vasospasm then stimulates the dendritic zones of the GSA neurons in that area of GVE distribution. These impulses are then conducted into the segmental dorsal gray horn and projected to the sympathetic cortex, which projects the pain to the surface of the body innervated by the GSA neurons. In reality, referred pain is rarely recognized or utilized clinically in veterinary medicine. Anatomic evidence supports a much more diffuse location of visceral sensory neurons than was formerly assumed, which may explain this observation. In the dog, 22 spinal cord segments are present and supply GVA innervation to the stomach. Special visceral afferent system. Taste. The primary receptors for the sense of taste, the gustatory sense, are responsive to chemical agents introduced into the mouth and are organized in taste buds, which are small structures associated with the various glossal papillae. Taste buds also occur in the soft palate, pharynx, larynx, lips, and cheeks. The taste bud consists of supporting cells and neuroepithelial cells arranged so that the shorter neuroepithelial cells are centrally located. This cell has a hair-like process on the distal, luminal, extremity that extends into a depressine in the center of the taste bud known as the taste pore. Here, the hair-like process is sensitive to chemical substances dissolved in the saliva. There is a rapid turnover of neuroepithelial receptor cells in the taste bud. Following denervation, the taste bud degenerates and reforms 1 to 2 days after the reinnervation of the tongue papillae. These neuroepithelial receptor cells are in synaptic relationship with the dendritic zones of the SVA neurons. Figure 16-3. The cell bodies of these neurons are located in the geniculate ganglion of the facial nerve and the distal ganglia of the glossopharyngeal and vagal nerves. The facial SVA neurons are distributed to the taste buds of the palate and the rostral 2/3 of the tongue by way of branches of the trigeminal nerve. The glossopharyngeal SVA neurons innervate taste buds in the caudal third of the tongue and the rostral pharynx. The vagal SVA neurons innervate taste buds in the caudal pharynx and the larynx. Another way of describing this anatomy is as follows. For the SVA neurons of cranial nerves 9 and 10, their axons course between the taste receptors in the mouth and pharynx and the medulla, all in the respective branches of these two cranial nerves. Their cell bodies are in the distal ganglia associated with these two nerves, 9 and 10. For the SVA neurons of cranial nerve 7, these axons leave the receptors and course with the branches of the trigeminal nerve that contain the GSA axons that innervate the same region. On their return to the medulla, these SVA axons leave the trigeminal nerve branches and join branches of cranial nerve 7 to reach the geniculate ganglion, where their cell bodies are located. These facial nerve branches are the major petrosal nerve and the chorda tympani. These pathways are depicted in figure 16-3. The coarse and central pathway of reflex activity and conscious perception are the same as those described for the GVA neurons in these three cranial nerves. In the cat, taste perception is located primarily in the prosylvium gyrus. As an example of these pathways in action, think of how a dog reacts to the prehension of a bitter foodstuff or how you would react. The immediate excessive salivation is the result of reflex activity between these SVA neurons for taste and the parasympathetic nuclei of cranial nerves 7, 9, and 10 that innervate the salivary glands. The continual chewing motions and other attempts made to eliminate this bitter foodstuff from the animal's mouth result from the animal's conscious perception of the bitter taste of the foodstuff on voluntary upper motor neuron corticonuclear activation of the GSE neurons in the motor nucleus of cranial nerve 5 in the pons and the hypoglossal nucleus in the medulla. The perception of taste is a psychological phenomenon, which involves the central projection of many afferent systems and the role of the higher centers such as the limbic system and contributes the factors of memory of past experiences. Although the primary afferent for taste is the chemoreceptor in the taste bud, Thermoreceptors and mechanoreceptors in the oral cavity and pharynx and olfactory receptors in the caudal nasal cavity also contribute to the sensation of taste. Special visceral afferent system. Olfaction. The telencephalic cortex may be divided on a developmental evolutionary basis into the archipallium, the pleiopallium, and the neopallium. The evolutionary older archipallium and pleiopallium make up the rhinencephalon or smell brain. On anatomic and functional basis, the rhinencephalon consists of an olfactory portion, pleiopallium, and a non-olfactory portion or limbic system, archipallium. The limbic system has evolved extensively in the higher species of mammals and in addition to the telencephalic components also involves nuclei and tracts in the brainstem. In the nav, the olfactory portion of the rhinencephalon is pars basalis rhinencephaly and the non-olfactory, limbic system portion is the pars septalis et pars limbica rhinencephaly. The olfactory, paleopulule, portion of the rhinencephalon is the SVA system designed for the conscious perception of smell. The non-olfactory portion, or limbic system, is concerned with the emotional response to afferent stimuli, one of which is the olfactory SVA system. Reflect on your own reaction to the smell of a delightful perfume compared with that of a rotting animal carcass. That difference is a function of the limbic system. The specialized chemoreceptor of the olfactory rhinencephalon is a bipolar neuron located in the olfactory epithelium of the nasal mucosa that lies in the caudal part of the nasal cavity. This is primarily the nasal mucosa that covers the ethmoid labyrinth. The cell body and dendritic zone reside in the epithelium. Between 6 and 8 long cilia project from the apex of the olfactory cell and lie in the secretions on the surface of the olfactory epithelium, where they are stimulated by chemical substances dissolved in the secretions. The unmyelinated axon courses quadrantally from the cell body into the connective tissue of the nasal mucosa and joins with other olfactory axons to form the olfactory nerves, cranial nervi. These nerves pass through the foramina of the cribriform plate of the ethmoid bone and into the adjacent olfactory bulbs. It is not clear what cells ensheath these axons in their course to the cribriform plate, where they become surrounded by dura and arachnoid and continue into the olfactory bulb. These olfactory neurons are constantly replaced by the basal cells associated with them in the olfactory mucosa. On the surface of the olfactory bulb, 4 highly organized layers of neuronal cell bodies and their processes are present. Here, the olfactory nerve telodendria synapse and glomeruli with the dendritic zones of the brush and mitral cells. Many olfactory neurons converge on a few neurons of the olfactory bulb. The axons of the brush and mitral cells of the olfactory bulb project caudally on the surface of the olfactory peduncle and are continued caudally in the medial or lateral olfactory tracts. The lateral olfactory tract terminates in the ipsilateral olfactory cortex that covers the piriform lobe, figure 16-4, and plates 1-4 in chapter 2. Synapses may occur with neurons in the cortex of the olfactory peduncle and the olfactory tubercle. The latter is a nucleus located between the medial and lateral olfactory tracts. The majority of the central olfactory projections are ipsilateral and project to the piriform cortex without a relay through a thalamic nucleus. This is the only sensory system that lacks a specific thalamic nucleus for cortical projection. The functions of the 2 olfactory bulbs are correlated by axons of the brush neurons in one olfactory bulb that course caudally on the olfactory peduncle and enter the medial olfactory tract to cross through the rostral commissure. These axons continue rostrally in the contralateral medial olfactory tract on the olfactory peduncle to terminate in the contralateral olfactory bulb. See figure 16-4. The olfactory peduncle includes the olfactory axons on its surface and the adjacent cortex ventral to the medial and lateral rostral rhinal sulci. Commissural axons in the rostral commissure also pass between the cortices of the 2 piriform lobes. This is the conscious perception pathway for the olfactory SVA system. The so-called reflex pathway involves projections into the nuclear areas of the limbic system. Axons in the medial olfactory tract enter the septal area, septal nuclei and subcallosal area. Axons in the lateral olfactory tract enter the amygdaloid nucleus and hippocampus. The development of the olfactory portion of the rhinencephalon, the SVA system, varies extensively among species of mammals. In the dog, the sense of smell is highly developed functionally and anatomically, and the canine species is referred to as a macrosmatic species. Primates are microsmatic, lacking a well-developed olfactory system. This is obvious just by comparing the size of the olfactory bulbs. The olfactory bulb in the human and the non-human primate is very small compared with the olfactory bulb in any domestic animal. It is remarkably large in all species of bears as well as in sea lions and also in possums. In the latter species, the olfactory system is well developed, whereas the remaining telencephalon and its neocortex are poorly developed. See examples of some of these species differences in figure 13-12, dog, figure 13-23, bear, and figure 13-31, gibbon. Experimental lesions in one olfactory bulb or peduncle produce unilateral anosmia. Bilateral lesions in the olfactory mucosae, bulbs, peduncles, or piriform lobes cause complete anosmia. Lesions in any part of the non-olfactory rhinencephalon, the limbic system, do not interfere with the sense of smell. Deficiencies in the sense of smell are difficult to verify by clinical testing. The owner's observations of the animal's behavior on sensing the presence of food or game in the field may be more reliable information. Substances such as cloves, cinnamon, perfume, xylol, and benzo may be used to test olfaction, but you have to be careful about using irritating compounds that stimulate the GSA neurons of the trigeminal nerve that innervate the nasal mucosa. Anosmia is an uncommon clinical complaint. The most common cause is severe rhinitis with involvement of the olfactory nasal mucosa. Head injury may cause the shearing of the olfactory nerves as they pass through the cribriform plate, resulting in anosmia. Information that infection by the canine distemper virus may cause anosmia without other clinical signs is unsubstantiated. Most often, in the few dogs that are seen with anosmia, the cause has never been determined and speculations have never been proven. We have performed numerous surgeries in both dogs and cats to remove unilateral neoplasms located in one olfactory bulb, peduncle, or frontal lobe and to excise the olfactory bulb and peduncle unilaterally without apparent clinical consequence for the sensation of smell. In addition, in dogs with relatively large non-resectable neoplasms that involve the cribriform plate and olfactory bulb both unilaterally and bilaterally, we have not appreciated clinical signs that could relate to anosmia. Inappropriate urine spraying and marking in cats is a behavioral disorder that used to be treated by olfactory tractotomy. This surgical method resulted in apparently minimal to no adverse side effects in these cats. The close proximity of other neural structures made unwanted behaviors and neurologic deficits a significant post-surgical possibility. Thankfully, this dramatic procedure has fallen out of favor because of the invention of clumping litter and a much better understanding of these behaviors by veterinary behaviorists. Olfactory tractotomy, from our perspective, should not be considered a therapy until all other avenues of treatment have been proven ineffective.